The final research presentation. My research about safety and effectiveness of Invocamet to control blood sugar in comparison to metformin. The background. Diabetes mellitus is metabolic disorder that's characterized by high blood sugar and insulin resistance. It's caused by resistance of peripheral tissue to insulin, and this leads to high blood sugar. Diabetes mellitus is one of the most common chronic disease in the world. The prevalence of diabetes in the United States is 9.4% of US population. Risk factors of diabetes including obesity, sedentary lifestyle, and family history of diabetes. Common symptoms of diabetes including polydipsia, which means increased thirst, polyuria, which means frequent urination, polyphagia, which means increased hunger, and weight loss. Diabetes causes many severe complications, including heart attack, stroke, diabetic nephropathy, diabetic neuropathy, diabetic retinopathy, which can result in blindness, and poor blood flow in limbs, which may lead to amputation. Other complications of diabetes, which include hypersmolar, hyperglycemic states, and diabetic ketoacidosis. Also, diabetes is 7th leading cause of death in the United States. Although there are many medications used for type 2 diabetes, including metformin, sulfonylurea, but they are not effective when used alone as monotherapy, and physicians usually decide to add another anti-diabetic medication to the previous anti-diabetic medication in order to control blood sugar. So we can use Invocamet as monotherapy and to be a drug of choice to treat type 2 diabetes. The purpose of this study. The purpose of this study is to indicate the safety and effectiveness of Invocamet to control blood sugar in comparison to metformin. Methods. 90 participants included in this study, each group with 45 participants. It's experimental study. The subjects to be selected randomly, and also the subjects in this study to be blinded. First group will be given Invocamet. The second group will be given metformin and placebo. Inclusion criteria including participants diagnosed with diabetes at least 3 months ago or more. Participants don't have any other health problem other than diabetes. Participants don't take a drug that have drug interaction with Invocamet or metformin. Although diabetic patients usually to be recommended by their physician to do exercise and to eat low-calorie diet. But we will make sure to put the participants on low-calorie diet and exercise, which is 30 minutes walking every day. So the comparison between Invocamet and metformin to be justifiable. The duration of the study will be 3 months, and we will collect the blood samples from participants before the study and at the end of the study, and send it to the lab to measure hemoglobin A1C. Hemoglobin A1C is glycosylated hemoglobin. Is the form of hemoglobin that's measured primarily to identify 3 months average plasma glucose concentration. So we will use hemoglobin A1C to measure the effectiveness of Invocamet and metformin on blood sugar level. Also, we will ask the participants directly about the side effect of Invocamet and metformin, and this method called prospective assessment of a specific side effect of interest. Prospective assessment of a specific side effect of interest is to ask the participant directly about the specific side effect of medication. Discussion. We expect to see Invocamet to be more safe and more effective to control blood sugar in comparison to metformin. And Invocamet can be used as a drug of choice to treat type 2 diabetes instead of metformin. The significance of this study. The potential impact of this study is to use the Invocamet as the drug of choice to treat type 2 diabetes instead of using metformin to control blood sugar effectively, to decrease the risk of complication associated with type 2 diabetes.